Hello, my name is Kathleen Lisson. I'm a certified lymphedema therapist and board certified massage therapist practicing in San Diego, California. We're here at my studio now, and I would like to welcome you to my plastic surgery recovery massage class. So I designed this class to share the techniques that I have found that are very useful in helping my clients after plastic surgery. And I've been doing this for over 3 years, and I help people with Brazilian butt lifts, with liposuction, with abdominoplasty or tummy tuck, with facelifts, and then a new segment of clients that I have a doctor referring to me is after breast cancer, when they have breast reconstruction. If they use a fat transfer to the breast for the reconstruction, I can also help with that operation, because that is to get the donated fat is liposuction. So we help with the liposuction part of that surgery. So what are we going to cover in this class? And like, why should you take it? Why should you spend the next few hours learning alongside me? So what I hear from different massage therapists who kind of want to pick my brain is, they have some of the skills and they're trying to make a step into this wonderful niche career in the massage therapy career, but they find that a lot of their clients will book with them, but then not rebook, or even worse, they'll rebook and then they'll cancel the appointment. And the clients have a lot of frustration over, this is expensive. I didn't really expect to do this. I kind of pushback from clients. And I feel that that may be because we're not doing all that we can, using all the techniques that we possibly can to help people after massage therapy. I also have other online CEU classes. I have one in marketing, and that really focuses on how to get the clients in the door, how to get the clients to call you and book an appointment, how to get the plastic surgeons to refer to you. But this class I wanted to focus on, once you have a client, they're walking in the door, how do you help them? How do you know more about what their issues are, what the surgery is, and based on how long they are after surgery, what you can help them with. So let's look at basically what we're going to go over in the class. We're going to start with describing the popular plastic surgery and orthopedic operations. We're going to talk about the symptoms and experiences of patients after plastic surgery. We're going to explain some contraindications to post-surgery massage. You shouldn't automatically get someone on the table as soon as they book. You have to know what some possible contraindications are. And then the big one for us after plastic surgery is if they have an infection, they have to get the antibiotics before we can work on them. List and describe the stages of wound healing. So this is what I really stumbled upon, and it's been so valuable to me to kind of understand the stages of wound healing, and how looking at what stage they're in is why I make my decision on what kind of massage I'm going to give them. So if we give certain type of massage 6 months after the operation, it's less effective than if we gave it 1 week after the operation. And consequently, if they go to someone who has no training in this and they get a particular style of massage when they're 1 or 2 weeks after their session, after their operation, it's not going to be as effective as maybe it would be far more effective of a massage for someone who hasn't had plastic surgery, or someone who is, again, 6 months out of their operation. So we have to know where they are in their healing, and that will guide us to say what kind of massage we're going to try. So I then list and describe which massage modalities are effective at these different stages of wound healing. And I'm also going to talk about client self-care. What actions can they take in between our appointments to reduce their swelling and the other side effects of their surgery? And all this is based on research. So I'll list the studies, I'll quote the studies, and then in the resources section you can see the URLs to the study. You can click on them and read the entire study. This is also really valuable if you're having a conversation with their physician or plastic surgeon or someone else that's helping with their care to be able to send a study and say, I am doing this research-based care, not just, what I heard, like I'm wonderful, I have all kind of expertise, but it's not just my word that you're going on. You're going for things that are actually evidence-based. How to design a sample session for a post-op client based on your current knowledge and skills. So this is the real value in it, is that all of these techniques, many of the techniques we either learned in massage school in our other CEU classes, or ideally you'd have a solid foundation on manual lymphatic drainage massage if you're helping someone in the first weeks after surgery. So having these classes under your belt will enable you to absolutely start putting this information they give you into action in your studio, in your next client load next week, starting on Monday, if this is the weekend. So that's really what I want to do, is show you that there's skills that you already have, or skills that you can learn in depth in these other classes, because this is only going to be a few hours. There's no way that I could teach you new massage techniques, especially online. You have to have a one-on-one in class with someone showing you in person how to do it. But what I want to instead do is, you already have these tools in your toolkit. Let's figure out how to use them on this clientele. I'll again discuss continuing education opportunities with you. There's wonderful classes that I have taken that definitely inform the way I massage my clients. ASTM training, I took the Graston technique training, some of the classes. I took massage cupping classes live and online, and all of these classes have really helped me to figure out what's going on in my client's body, and then be kind of inventive in the studio. What is going to help them, and try it and see how it works, and then the successes you can take on to do to other clients as well. And then at the end, select, I'm going to show some resources that you can pass on to your clients to help them. So that's basically what we're going to be doing in this class. And a lot of it will be written, so you can refer back to it, and some of it will be video, and then some handouts, and again, this wonderful list of resources at the end that you can print out these studies and share them with the other members of your client's care team. So I look forward to learning with you. Have a good day.